Every minute, a child in Uganda dies from malaria. This is the story of one of them and the fight to save his life. Malaria attacks the red blood cells. In children, it quickly leads to severe anemia. When health centers run out of blood, the fight becomes even harder. In many rural areas, life-saving hospitals are hours away. Delays can be deadly.
The head of pediatrics department at St. Mary's Hospital, Acho, and also double as the deputy medical director for clinical services. I'm here to talk briefly about malaria. So in brief, malaria is a potentially severe and dangerous disease that is caused by a parasite, that's the Plasmodium. In Uganda, there are different hierarchies of treatment for this disease because there is what we call uncomplicated and complicated malaria. Now, the village health teams have been empowered enough to do rapid malaria tests within the communities because that is where the people come from. And usually when they do this test and it turns out positive, but the patient does not have signs of severe disease, treatment can be given usually by these VHTs, or they can be sent to the lower level health facilities, the health centers, where they can be treated by more professional healthcare workers. But sometimes the disease is so severe that the health centers cannot manage. And this prompts them to refer these patients to a higher level health facility. An example is the main hospital where I work. So a lot of times we receive these patients who come with severe forms of malaria. How do these patients get to the hospital? So the ones who come, for example, from our 3 health centers, that's Lacho, Pit, Pabo, and Amuru, we have an ambulance service that picks them from these health centers and bring them to the hospital. But we don't only receive these patients from the health centers that are affiliated to us. We also get from the other health centers, okay, or the other medical facilities. Challenges in the management, especially for the anemia, is blood. For a long time, we have also had shortage of blood. And I think as a hospital, for starters, we are the biggest consumers of blood that's collected by the regional blood bank. But on a sad note, most of the time, we get less than 50% of our demands. And for the department I work in, pediatrics is the leading consumer of these blood products. And most times the reason these patients need blood is because of complications of malaria.
The treatment works, but only if it's in time and only if the supplies are there. Many children don't make it this far.